Doctor is in, and today's topic, thyroid function. Our thyroid gland is such an important part of our lives. In fact, it impacts every single system in our body. But thyroid problems are on the rise, and if you haven't been feeling yourself lately, you may be one of the millions in the U.S. with an undiagnosed condition. So joining us today is Dr. Scot Ackerman, one of the First Coast leading oncologists, and he is with us every week to discuss a variety of topics. And today, of course, we're going to talk about the thyroid. Thanks so much for being here.
Thank you, Jennifer.
Well, let's go ahead and get to the basics and talk about what is your thyroid and why is it so important?
The thyroid is a gland that we have. It's in the lower part of our neck. It's a butterfly-shaped gland, and it secretes hormones into the bloodstream. Two hormones primarily, T3 and T4, and these hormones have to do with our metabolism. They regulate our heart rate, our blood pressure, our body temperature, our growth and development, those sort of things.
Okay. Now, what are some problems that are associated with your thyroid?
Well, one of the more common problems that we see are something called goiters. And you may have seen people, friends or neighbors or people in the street that have an enlargement in their neck, just a large bulging in the lower part of the neck. That's called a goiter. And it's caused by all sorts of things. It could be caused by nodules or masses in the thyroid, or could just be a swelling of the thyroid. We also can get nodules in the thyroid, and these nodules that we find in the thyroid glands they're generally non-cancerous,
okay,
usually benign, what we call just benign growths in the thyroid, adenomas, and sometimes they could be cancerous as well, but that's pretty uncommon. And also the thyroid could be functionally abnormal, meaning that it produces either too much thyroid hormone or too little thyroid hormone. So too much thyroid hormone is called hyperthyroidism, and it leads to weight loss and those sort of things. But hypothyroidism, on the other side of it, is when the thyroid just doesn't produce enough thyroid hormone. In fact, that's so common. I walked in today and I met a woman coming in who told me that she recently found out that her thyroid kind of petered out, and she's on some thyroid medication. So when your thyroid peters out or becomes hypothyroid, it leads to it has underproduction of the hormone, and that leads to weight gain and just sluggishness.
So you mentioned seeing a woman today just by chance. I know my mom suffers from a thyroid condition. You hear about it quite often, but are thyroid problems common?
Yeah, they've always have been very common. And I told you I saw a woman, and you talked about your mother. Actually, it's much more common in women than it is in men. But goiters and functional problems, hyper and hypothyroid, are very, very common, and they're treated fairly easily. They're easily managed, and they really hasn't changed in the frequency of those conditions. But what has changed, is what's rather interesting, is that thyroid cancer has increased tremendously. Over the past 10 years, there's been over 170% increase in the incidence of thyroid cancers. Now, a lot of people have speculated as to why this is. Is it environmental factors or something else going on? But I truly think that the reason that we're seeing more thyroid cancers is better screenings and better ways to diagnose these earlier. In the 1980s, we developed something called the ultrasound. The ultrasound uses sound waves, and we use it to see babies in the womb. And the ultrasound is also used to evaluate the thyroid. And the ultrasound was invented in the 80s, and in the 90s it became used more. And with that, we're able to detect very small nodules in the thyroid and find out that some of these small nodules are cancerous. So hence, that's the real reason, I think, that there's been such an increase in thyroid cancer.
Better detection and more knowledge.
Early detection.
Right, early detection. So what are some of the signs or symptoms that someone should look for and say, hey, maybe I need to get into the doctor to get this checked out?
So if you notice an abnormal weight loss or weight gain, if you have an irregular heartbeat, palpitations, some tremors, that sort of thing, if you have some difficulty swallowing or breathing, it could be a mass in your neck, a lump in your neck causing difficulty swallowing or breathing. These are all potential signs of a thyroid problem.
Okay, and again, obviously, go to the doctor if you have these symptoms, but more importantly, why should somebody go to a doctor about this?
Well, you want to go to the doctor as early as you can when you have these symptoms to be sure that there's nothing going on. But if there is something going on, it's good that if it's caught early. Remember, 95% of thyroid masses and nodules are non-cancerous, and most thyroid problems, be it hyper or hypothyroidism, are treated very easily with medication, either supplemental medication if you have low thyroid levels, or we have medications if you're hyperthyroid. We have medications to treat that as well. And sometimes we give radiation. A little radioactive pill of iodine is used if someone's hyperthyroid. to eradicate the thyroid and bring it back to a normal state, or to a hypo state where it's more easily managed. And also, if you have cancer in the thyroid, it's great to catch that early. And because of the advances in early detection of thyroid cancer and the advances in treatment of thyroid cancer, today thyroid cancer is the most curable, one of the most curable, if not the most curable, cancers that we see. 97% of thyroid cancers are cured, cured either with surgery or radiation. If you're going to get cancer, that's the one to get because it's so curable.
Right. And more importantly, the early detection is even that much better because the treatment's less invasive.
And you also have more options when things are detected early.
Well, thank you so much for joining us.
Thank you, Jennifer.
All right. Well, Dr. Ackerman had plenty of insight and information. He is with us every Friday. And next week, we'll be talking about MS, which is multiple sclerosis. For questions regarding this topic or any other health questions you might have, just visit firstcoastoncology.com and confidentially submit your questions to Ask the Doctor.